Yes, your sister's coming to put me on camera.
Okay.
We can scoot.
Yeah. Hello. Hello, everyone. We're going to start this interview. I think it says live. Can you hear me? Okay, I think it's going. I don't know how to pronounce your last name.
Oh, my name is Maile Mosanian, and I am an occupational therapist. And we are here at Empire Pediatric Therapy South. We will be opening Empire Pediatric Therapy North, hopefully by May.
Really?
Yes.
Like whereabouts? Because we're on the South Hill of Spokane.
Yes. We between Winco and Chuck E. Cheese off in Nevada. We just put an offer in the building.
Oh,
yeah,
that's amazing.
Yes.
So you're gonna have this place on the South Hill and then one on the north side by May. Okay, that's crazy.
And I'm due May 8th.
And you're due,
so hopefully it happens before that.
Oh my gosh! And you're supposed to be like all calm and
calm. It actually invigorates me to do more and be better because this method is just so amazing that I want to be able to give it to so many more people. So
so that's a good segue. What do you do? Because you're not just a pediatric therapy clinic. You have a particular niche.
Yes. So what we do is called the Moskotova method.
Okay.
And the Moskotova method originated from Svetlana Moskotova. She's a psychologist out of Russia who came up with this method based off of infantile reflexes. And so she... the way that she came up with this method was she put on an astronaut suit and then put someone under MRI and did specific tactile inputs and proprioceptive inputs to the body to show where the neural pathways were being developed in the brain. So we carry out those same methods. We use tactile and proprioceptive inputs that she guides us to use.
So when you say infant reflexes, like I know what that means.
Yes.
But can you give just some examples for the mamas that are watching?
Yes.
Like what might a reflex look like in their baby?
So a lot of what you'll see in your infant is like the rooting reflex would be they get a swipe on the cheek and they turn towards the nipple of the bottle or the breast. And another one is like hand grasp. So you put your finger in there and they automatically will cover your finger around.
So they're not just extra strong children?
They'll hold up their own body weight because they have that wonderful reflex intact. Or they'll hold their own body weight by standing or doing that stepping. All of those are natural reflexes.
Those are natural reflexes.
Yes.
Okay. So this technique, the MNRI, what does it do, or why would you need to do that reflex?
So for most children, they're born and we go through what's called a transition phase where we use those reflexes to our advantage in order to gain the skills that we need to do. So for, say, like crawling, we need reflexes in order to get us into the crawling position and then to activate crawling. But if we don't go through those transition phases in order, or they don't integrate when they're supposed to, then those children have a variety of different symptoms depending on which reflexes didn't integrate.
Okay. What would some of those symptoms look like? Like, what are the diagnoses that you treat or can treat?
Yeah.
And if you don't touch on some of them, I will ask
you. Please, yes. So things like scoliosis, anxiety.
Now I have to stop you.
Yes.
Because it's not just scoliosis. Before we got on camera, you were talking about significant scoliosis.
Yes.
Will you tell?
So we had a little girl that had 56 degrees of scoliosis, and now she's down to 17 degrees of scoliosis by using this method.
And that is amazing because in school there were stretches and strengthening things that we could do for, someone who has scoliosis. But if it progresses, it's braces and surgery. And you're saying, and usually surgery I think is like 40 some degrees.
Yeah.
So she was able to not have surgery.
So she was wearing a TLSO, a clamshell that went around her body to keep her body in alignment, because she even sat with a different posture because her scoliosis was so...
And that affects breathing, and for me, that affects pelvic floor, incontinence, and all of that.
Definitely.
So you're saying that if somebody has scoliosis, that is not normal, and it's because a reflex has not been integrated, is what you're saying.
Yep, so it's a spinal galant reflex is typically responsible. So there are 3 reflexes that could be responsible for different scoliosis in the body, but spinal galant tends to be the big one.
Okay.
And what spinal galant is for is when you are in the birth canal and you are trying to wiggle out down the vaginal canal, the spinal galant is activated by the sides of our back being stimulated.
Okay.
So it literally gives us this
It
movement.
like gets the baby to wiggle out of the canal.
Wiggle. Yep.
That's amazing.
There are 3 wigglers.
Okay.
But that's one of them.
Okay.
And what happens is the reason that girls typically get an onset in puberty is because we strap a bra to the back, and now we're stimulating the spinal galant over and over and over and over until we go into an unnatural pattern.
Really?
Yes.
We didn't talk about that. That's amazing.
Yep.
So don't put a bra on your child.
Well, or have their spinal galant
Or have
integrated.
their
Yes.
spinal galant.
Yes.
So, okay, I know I just went off on a tangent, but C-section babies?
Yeah, so C-section babies don't go through the natural birthing process. So as you are going through the vaginal canal, you're getting trunk extension, Babinski, spinal galant, spinal Perez, Landau, and then as you exit the vaginal canal, you're getting ATNR, which turns your body, and then turns your body to come out of the vaginal canal, and then you go into Moro, which is our startle reflex.
When the baby comes out?
Yep, when the baby comes out, and then go into the cry. And then what's supposed to happen is the baby comes out of the vaginal canal, and it's supposed to go up on mom's belly, where they bower crawl on their belly up to mom's breast, where they suckle. And so all of those steps happen, and then as well as that contact onto mom's chest for bonding.
So if you didn't get that, me and my child, then there can be problems.
Yes. Well, and I see any baby under 30 days without a referral, they just need to call the office.
Okay.
And I'll take them through the birthing process so that they don't miss those steps for their integration.
Because what might a baby look like who doesn't get to go through all
lots
of that?
Those kiddos will have anxiety, or they'll have poor touch discrimination, so they don't like to be held or touched.
That's my daughter.
They'll have, again, that spinal galant that doesn't get integrated, or trunk extension, or Babinski.
Like extra fussy baby?
Yeah.
Is that something?
It could be an extra fussy baby, but most of that comes from a different, and I'm not an expert in this field, but from the bacteria from mom's vaginal canal that enters into baby, which gives them part of their immune system, and especially in their digestive system. So if they don't get those passed through the vaginal canal, then they have a hard time digesting, and that's typically why they're fussy colicky.
Oh, okay.
Yeah.
So you were listing, before I got off on this tangent, you were listing some of them. Scoliosis.
Anxiety, which is Moro. Fight or flight, so kids that run away from you, that would be a different reflex. We have feeding and eating is all part of our suck, swallow, breathe that comes on in infancy, and then as well as the internal drive to want to eat. So we see girls with anorexia.
Like little girls?
Or older girls.
Girls.
Yep, teenage girls that'll come in for anorexia or bulimia. And then we have...
Because they just have no desire to eat.
Desire. Yep, and that is actually a reflex.
That's a reflex. So if parents are like, my child will only eat 5 foods, that could be because... That's
because they don't have that internal drive to want to eat. And so they eat whatever is there that they
kind
prefer,
of picky.
But they're not really interested in food, which is... part of, we need food to thrive and live, right? Especially a variety of different nutrients. So if our body isn't craving those, it's because Babkin and or chewing and swallowing, those 2 reflexes are not integrated.
Is there another one for like those that don't like textures, like a sensory?
Yep, so that one would actually be a completely different protocol. That one is called the tactile protocol.
Okay.
So what we're talking about right now is called dynamic and postural reflexes. Those are our basic 23. And then there's another protocol that you can take through the Muskotova method, MNRI, that's tactile integration.
So those that are like sensory seeking, everything's in their mouth, their hands are in their mouth, versus like sensory avoiding, they don't want to be touched. That's kind of that other one.
Part of it can be that they didn't get enough oral stim.
Oh.
So that's Babkin.
Okay.
So that's not tactile technically. So if they're oral seeking, it's because they need their oral cavity to be integrated, and it's not, so they keep putting everything in their mouth.
Or like the binkies. They can never get rid of binkies.
Yep. That's Babkin, where tactile is very specific to the receptors of the skin.
Oh, okay.
So it's not a seeking.
Okay.
It's more avoiding.
Okay.
Yeah. Or crashing.
Yeah.
So one high end of the spectrum or the other, where like kids won't have the nociceptors for pain, so they fall off of things on purpose.
Oh.
Yes.
Interesting. Okay. You were talking about autism.
Yes. So, there's peer-reviewed articles on the Moscatova website. So, muscatovamethod.org. And you can go to some peer-reviewed articles that talk about how impactful this method is for autism. Because what autism is brainstem malfunction. And so what reflexes do is they go up the spinal cord, they go into the brainstem relays the information into the brain. And if the message gets stopped or gets misinterpreted by the brainstem, then dysfunction starts to happen, and that is definitely our kids on the spectrum.
Okay.
So we start at base and we work our way up and get all those reflexes to be integrated.
And you're seeing
huge results. Nonverbal kids talking, and toe walkers having flat plants, and behaviors diminishing, and being able to transition from activity to activity, all because
social interactions.
Yep, social interactions improving because of the reflexes by themselves.
Now, we talked about toe walkers. Can you tell us about that?
Yeah, so that's trunk extension, the reflex trunk extension. And what that does is it gives us our upright posture.
Okay.
And so I know everybody sits up straight. Gives us our upright posture. And so if we don't have that upright posture, we continue to seek for it. And so we go up on our toes so that our posture then comes where it needs to be.
Okay.
And so they're constantly seeking to have that input.
Extension.
That extension, so that their
and that's
body,
not normal.
And that's not typical.
That's not typical.
Yes.
It can be normal. And like if that's your normal, in your normal functioning.
Meaning that if you are toe walking, it's part of your norm.
Yeah.
But it's not typical for the nervous system.
Oh, okay.
Yep. Mm-hmm.
And there's reflexes for that will help to take that. And you were saying, what's the long-term effects of toe walking?
The long-term effects of, and it doesn't necessarily mean toe walking. So some people, the toe walking is the symptom.
Okay.
But in other people, the symptom can be like the dowager's hump that you get later in life for the women that have that curved back.
Okay.
And it's also, if you get your trunk extension integrated, is the best thing to do for preventing dementia or Alzheimer's. Because it's a myelinization of the brain.
Oh my goodness.
Yeah.
I'm just like in awe about what you can treat.
It's amazing.
I love it. Amazing. Did we talk about sleep?
Yeah, so sleep, so ATNR, asymmetrical tonic neck reflex, is a very persistent reflex that happens in our bodies because when we turn our head as infants, then our arm goes out and we start to turn on our auditory processing system as well as our visual system. And so when we are in this position as infants, now we're in high alert. We're listening and we're learning.
Okay.
And when we go into sleep, we actually go onto our abdomen and we go into the opposite posture. So now I've turned off my auditory processing system and I've gone onto prone on my belly and I've turned everything off so I can sleep. So I wake up and I'm here, and I go to sleep, and I'm here.
So you'll find that in kids?
Yep.
Like, that's...
Yep, so we integrate the abdominal sleep reflex.
Okay.
So that they can sleep.
Yep,
fall asleep and stay asleep.
And you find really good success.
Great results.
Sleeping!
Yeah,
oh my gosh.
Sleeping.
And I know that, you're a pediatric clinic, but we were talking about this can be for any age.
Oh, yes, any age. In fact, we had a therapist that works in home health for the geriatric population, and she says she uses these all the time and what a huge difference it makes for her patient population. And then there's a PT clinic in town, Paula Dillon Mays' clinic. She's got one in every area
it's
of
like
Spokane.
Paula Dillon North, South, Paula Dillon, yes.
Yep,
okay.
And she has a physical therapist at each one of her locations that also works on these for adults.
For adults.
Yes.
And so I was asking you about kids with a lot of tone or adults with a lot of tone.
Yes.
Because of stroke. And, you know, as a physical therapist in geriatrics, it affects their ability to stand, walk, move.
Yes.
And you're saying huge
changes
in tone.
Yeah, so the earlier that you can do the intervention, either for an infant or for someone who
just had a stroke.
Yep, who has just had something happen to them, like a physical or emotional trauma.
Okay.
The faster you can get to them, the quicker you can recover things like tone.
Okay.
And so it's not that it's impossible to do it afterwards, but there's such a great impact that can happen right after something has. And so you can change people's tone, you can change their gait, you can change change their posture, you can change everything. So
okay. So did we talk about, so those are some of the things that you can treat with the MNRI technique.
Yep.
I was going to ask something, and now I forgot what I was going to ask. I'm going to blame that on my daughter and my mommy brain. I had something really important to ask you.
We'll come back to it.
We'll come back to it.
Another thing that we see infants for a lot is reflux.
Okay,
so we see lots and lots and lots of infants for reflux. And we also see torticollis, any feeding, eating, so they're not keeping food down, anything like that with infants. The earlier we can get them, the better.
Okay.
So I had a little one that came in who had a diagnosis of CP when she was born, and I got to see her at 9 days old because her sister works for us.
Oh.
And went back to the doctor, and doctor said we must have misdiagnosed her. She no longer has symptoms of CP.
Oh my gosh, you're kidding.
No, but she's still with us because she's having difficulty with suck, swallow, breathe. So but she has no more reflux. So even though she was
diagnosed with cerebral palsy, which is like a stroke in adults, and they're like, we must have misdiagnosed her. That's amazing. That's like
her range
amazing.
and her tone in both arms and both legs was completely even, and she had a hemi type infarct of the So her right side was in high tone, and now she looks completely even.
Oh my goodness.
Yeah,
I know what I was going to ask you.
Yes.
So why would these reflexes need to be integrated, or what happens? Like, what has to happen? You kind of said any trauma, physical or emotional, can bring these reflexes. What did you call them? Back into like they're either integrated or protection.
Yes. So like later, so we have all of our reflexes integrated, say, and then we have a physical trauma.
Okay.
Our body will go into protection.
Okay.
And it will bring on whatever reflexes it needs to bring us into protection. And what should happen is that they should naturally start to reintegrate. But what happens in our society is that we don't give it time to do that, and then we get stuck in survival mode.
Okay.
Either emotionally or physically.
Okay.
And so say someone has, say someone has a fall.
Okay.
And they don't break anything, but all of a sudden now their gait is off and we can't figure out why. There's no musculoskeletal reason, but it's because Babinski in their foot has now gone into protection because it tried to catch them and it didn't work. And they fell over. So now we're going to work on Babinski to try and get that reintegrated so that their gait can be the same as it was before.
Okay.
Yeah.
Or we were kind of also talking about maybe like a PTSD incident, like an emotional, and then that just stays with us.
Yes. So we actually have seen quite a few survivors of the Freeman Strong, and they were in the hallway when there was shooting, and we don't do any talk therapy. All we do is reintegrate the fight or flight reflex, and that reflex is called fear paralysis, and we go through what we call our PTSD list of symptoms that they could possibly have in other reflexes, but we mostly concentrate on just making sure that their body isn't stuck in fight or flight, because that's what happens.
Because I'm sure these kids are just like emotionally traumatized, and they can't, like, is it like attention to tasks and stuff like that? Like what are some of the symptoms that you might see?
We
like
even had
emotional crying all the time.
Yeah, we had a girl that wouldn't go back to school. But like for our kiddos who don't necessarily have a big trauma that happened, like at Freeman, they will be in fight or flight because of some reason, possibly we don't even know. Maybe they fell off the couch when they were little, and parents don't even realize that had anything to do with bringing on their fight or flight system. And I'm doing that reflex wrong. This one is Moro.
Okay.
This one is fight or flight. I'm going to get in trouble.
Yeah.
And they look like behaviors.
Okay. I was going to say, what does that look like?
Yes, they look like they're running away from you, or
not
they're
minding,
screaming, or they're, and you're like, I don't know why you're acting like this. And we actually get a huge percentage of our referrals is because they're non-compliant, kids are non-compliant, or they have behaviors and parents don't know why.
Okay.
And so we get them in here, and the first thing we look at is emotion. And so
and you're seeing huge changes
in
behaviors.
Yes, we had a sixth grader that came in, and her mom both vocalized like she's just a new kid, like she's just okay and happy to be alive, and
that's amazing.
And there was just so much conflict before, and now they're like, oh my gosh, I get to go home and just enjoy.
And maybe
my daughter.
you don't pinpoint what happened, but
no.
Okay,
Mm-mm.
and that's okay.
I don't care what happened.
Yeah.
Yeah.
And you said every child needs to be tested.
Oh, gosh, yes. It would be great. Well, and the fun thing is that, we get these kiddos in, and there's a specific evaluation that we do, and we make sure that all of their reflexes are integrated. So even if they come in for one specific thing, we want to make sure they leave as a whole package.
Okay.
Yeah.
And you're saying also adults, too.
Yes.
If you haven't, because injury, pain, chronic pain, stress, all that stuff can play a part, and they could be in this.
Yep. They're just, their bodies are in protection.
Yep, which can cause so many diseases, chronic diseases, and everything like that.
Yeah.
One thing that I was really interested in is, potty training, bedwetting, constipation, that inability to potty train. And when I was looking over some of my books from my classes, it was talking about specific reflexes and inhibition of some of these to get you to become potty trained. And I was like, there's these reflex loops that I was looking at that need to become integrated so that you have an awareness to go, so that you have like the control, this coordination of relaxing your this is like the nitty gritty, but relaxing your pelvic floor so that your bladder can contract and you can pee. Or if you have the awareness to pee, you need to be able to hold it until you get to an appropriate place, or holding it at night. I know that that's a big concern. So these are also reflexes that need to be integrated.
Absolutely.
Okay.
Yeah. So we work on incontinence, and I can't tell you how much success we've had with it. It's so exciting. So like we have little ones that come in, and they're kindergarten, and mom's like, they are wetting the bed every night, and he's having to wear a pull-up at school, and he's getting embarrassed, and in a matter of weeks they're completely continent.
They're amazing.
Yep.
Because some of my friends, it's like they want to go. Like they want, they're excited. They want to go on the potty, but there's nothing, like it's just not working. And I'm like, that's not my area of specialty. But it sounds like it could very well just be a reflex that hasn't been integrated. So they're stuck kind of in this automatic going, and there's no control. That baby phase.
Yes, absolutely. And actually we had a 5th grade girl that was brought to us that was still incontinent, and she was crying to us that how excited she was that she didn't have to wear a pull-up anymore or have to go into the nurse's station to get a new diaper on. And she was just so excited. Yes.
And constipation too?
And constipation too. Yep. So any constipation or even diarrhea,
like you said, IBS.
IBS, yep. Anything that's going on with the bowel bladder system, we can definitely help.
And one of the things that you were saying is like diet is huge.
Yeah. So
and helpful in your integration.
Yes. So for the kids that do have even a little bit of an allergy to, say, gluten, and we don't know it because they're functional human beings, and so we say, oh, they must not have a gluten allergy because their nose isn't running, or they're not, it actually causes a lot of inflammation in our body. So in the gut, and then if our body is busy taking care of the gut, it's never, then it gives us blockages to be able to create those integrations for the reflexes. So, at the beginning, we'll just treat them the same way that we do every other kid, and then if we get stuck, we start to talk to parents about diet, because if the neural pathways are not being developed for those reflexes, there's a reason.
Because of inflammation.
Okay. Yeah.
That makes sense.
Yeah.
Do you have anything else that you want to add? We talked, I think, a long time even before we came on the video, and it was...
No, I just want everybody to know about this.
Yes,
I do too. People are questioning me, like, why would you be spreading this? Why wouldn't you just keep it for yourself so that you can grow your practice? Right. And I'm like, that's not humanitarian.
Right.
Everybody needs to know about this.
Right.
And everybody needs to go out and do this, because it's literally going to change how our society functions. I think in 10 years from now, everybody will be practicing this method.
Because it worked, like you are seeing it work. I was hearing that therapists are coming to you because they are also seeing the kiddo, like maybe you're seeing them for occupational therapy, but they're also being seen for another therapy, and they're like, what did you do?
Yes.
Teach me your ways.
Oh, one of the other things that we didn't talk on was speech.
Oh, yes. That's good.
So there are 10 reflexes in those first 23 that also help with speech and artic.
Okay.
And so we have speech therapists that do the basic 23, and then they also do oral facial, and they also do auditory processing. So those are 2 additional classes that you take after the initial class. And so our speech therapists are amazing with what.
And you're talking like swallowing. What kinds of
suck,
things?
Swallow, breathe.
Talking.
Clearing out the middle ear because of ear infections.
Ear infections?
Yes.
Oh my gosh. Like they don't, like maybe they don't need to be on antibiotics their whole entire life, or get tubes and stuff?
No tubes. We don't want tubes. Yep. We just want to clear out the middle ear.
And you can clear out.
We can clear out the middle ear. Yep. And prevent.
I did not know
prevent
that.
tubes. Oh, I had something and then I lost it. I'm like, oh, dang it.
You're pregnant. So we can blame it on that. It'll come back.
But, so like for kids who have expressive and receptive language concerns, it's all about auditory processing. And so the auditory visual class that we took will work on those expressive and receptive language, but then also with vision. So we had a little kiddo who came in with congenital nystagmus, and they say there is no cure for congenital nystagmus. You're just going to have it. And what that means is the eyes kind of go back and forth constantly. And now his eyes are completely stable unless he's tired. So we're starting to see a reversal in his vision. And so
vertigo then?
Oh yes, vertigo.
Like if you've just had vertigo your whole entire life, or you get it, because I treated the BPPV,
yes.
With that positional stuff. Can you do
yeah, so we'll realign the crystals in the ears. We just do it through reflexes instead of through.
So you don't have to make them dizzy. Like I have to physically make them dizzy and oftentimes throw up to get them. That's amazing. So then you said expressive and receptive speech. Are you talking like I can do this on my clients with stroke?
Yes.
So those that have a stroke and they're just mumbled, like they know what they want to say, but they can't get the words out, or they just are saying they're expressing crazy. What?
Yes, we just need to heal those parts of the brain and.
Okay.
And they'll create new pathways too. So like if it's, typically with this ADA, you're looking at one side of the body. So if you train the side of the body that's non-affected, the other side of the body will then start to remyelinate a pathway in the brain that will take over for where it was happening in that part of the brain that's now impacted. And so
amazing.
Yes.
I feel like I've done a disservice to all of my clients who've had strokes. Like when I worked in the hospital, this is something that could have in the hospital
right away,
right when they have that
away.
They need to be this is amazing. And the results speak for themselves.
Oh gosh. And I'm not saying I'm 100% going to cure a stroke or 100% going to bring a child with autism into the typical developing. I'm not saying that I'm 100% curing, but what I'm saying is that I'm making so much impact that people are. There's no way that you can say that this method doesn't work,
right?
Because you're making these huge changes that no other method has been able to give.
Right.
So, yeah.
Oh, man. There was something that popped into my mind as we were talking, but it popped right back out. Just because my brain is like overwhelmed with this amazing technique.
Well, you feel so...
I bet you feel empowered.
Oh, well,
like I'm feeling empowered
yes.
right now. Like I can actually, there's something that you can do to make a difference quickly. It's not like you don't need to be seeing kids for 5 years potentially.
Yes. So most of our discharges are happening around 9 months. So we're seeing them and we're getting them out.
And you're getting them out.
Yes.
Not because they're not making improvements.
No, because they've made all the improvements that they need.
Yeah.
And then every once in a while we'll kind of check in and make sure that they haven't had an emotional or physical trauma, and we'll do like a little, refresh if they have. But, generally speaking, other pediatric therapies will have kids on for years and years and years and years.
Yeah.
And we're like, please just get them out as fast as we can, because we're getting in 5 to 10 referrals a week. So
as people are hearing
more about it. Yeah. So I need about 8 more therapists right now because
chronic pain.
Yeah, chronic pain for sure. Yeah, and there's
things that you can do.
16 classes, and I've taken 8.
Okay. Oh.
So
okay.
I'm
so
getting there.
Getting there.
But like they have a class called neurostructural point activation, and it can actually reverse a seizure while you're having it.
What?
Yes.
Reverse a seizure while you're having it?
Yeah. Isn't that nuts?
That's unbelievable.
I can't wait to have all of the classes, so I have the full picture of everything that I can do for these.
Oh, my word.
Yeah.
That's amazing. That's really amazing. What you do is amazing. And I was telling somebody, like, I really want to interview you because you are the only clinic that this is what you do. There's no play therapy. There's nothing else.
We don't do anything else.
And, if you say, oh, you need to take your child to a pediatric therapist, most of them will say, like, I've already been to one. It doesn't work. But you're that one clinic coming up to 2 that, they need to find. Like, this may be...
Excuse me.
Yes. This may be that missing link. And that's kind of why I wanted to come see you, because it's the same thing with me and my pelvic floor physical therapy. Just this little niche, it may be the missing link to...
That's funny, because that's their catch line.
Oh, really?
The missing link.
The missing link? Oh, I did not know that. Okay, so how do they find you? You have a website.
Yes, I have a website, empirepediatrictherapy.com.
Okay.
I have a Facebook page.
They need a referral.
Unless
they're the, what did you say? 0 to 30 days?
0 to 30 days doesn't need a referral.
Newborns, 0 to 30 days.
Newborns is what I'm looking for. You can just come in, schedule with our office. We'll get you on the schedule, and it's just called a screen. Yeah,
okay.
And we'll just get a consent form signed that says that I can put my hands on the kiddo, but we don't worry about insurance. It's just a one-time 15, 20-minute take you through the birthing process, and then you're out.
Okay.
So if I see other concerns, I of course will say, I kind of see something going on here. But usually under 30 days, they're a quick fix.
They're a quick fix, and that's when you want to see them. And let's see, they need a referral otherwise.
Yep.
And you take
All
insurances.
Yep.
You're on the South Hill. You will be on the North Side. Do you do home visits?
We do birth to 3 home visits.
That's amazing. Okay, and where is your district, or where
Our
will
district
you go?
is all of Spokane County.
All of Spokane
County. And we are in the works to do Stevens, Lincoln, the surrounding counties.
Okay.
I don't know all their names.
How long for that initial evaluation?
Right now, we're about a month out for OT.
Okay.
Maybe 2 months for speech therapy, and physical therapy is maybe 2 weeks out right now. Yeah. So.
Okay. And they need an hour? Is it an hour for that?
An hour for the initial eval, and then just under an hour for all of the visits after.
Okay.
Yeah.
All right. So if some viewers have any questions, then they can ask, and then I can send them to you.
Yeah.
Or if they want to contact you through that, maybe I could just give you or I'll give them your contact information.
Yeah, it's just Maile at empirepediatrictherapy.com.
Okay.
My name is spelled Maile.
Maile.
Yes.
Okay.
Yes.
This has been great. Thank you so much.
No, thanks for coming. That's
Yes.
great. Spread the word.
Spread the word, yes. Okay.